everybody. I'm Angela Hart. Welcome to the Heart of New York show. We have a very distinguished panel on the show today. They're here from Ocean Medical Center, and they're going to help the community learn about different medical topics that are very important to the community. And I'm going to take this time to ask them both to introduce themselves to you and a little bit about their nonprofit organization, and it's huge. So I'd like to start on my right. Please tell the viewers, introduce yourself, and tell them about your extensive background.
Thank you, Angela. I'm Dr. Brad Pulver. I'm an emergency medicine physician and chair of the Department of Emergency Medicine at Ocean Medical Center. I have been at Ocean for 11 years as the medical director, and in that capacity, I work clinically, seeing patients along with the other emergency medicine physicians, and I also am the administrator of the department, making sure that the quality is good and that the patient satisfaction is good, that the throughput is good. So that's all part of being the medical director of the hospital.
Thank you so much. Thank you for sharing with us. Sure. And you, sir, would you like to share with the viewers who you are and what you do at the hospital?
Sure. Thank you, and thank you for having us. My name is Ken Suchek. I am a physical therapist by training. I am the corporate director of outpatient rehabilitation at Hackensack Meridian Ocean Medical Center. Hackensack Meridian is a conglomerate that has really come together incredibly to change the whole paradigm of healthcare. We're looking to change the market share, the market drivers, and where we're trying to head. And by doing that, we have great hospitals, but we also have an opportunity to share across the whole continuum. We have long-term care, assisted livings, we have acute rehab, outpatient rehab, and like Dr. Pulver said, we have the emergency room, which is the front door and the entrance point, but then we take care of people straight through that continuum. So it's a great opportunity for us to kind of really partner with the community and be part of that to take care of them.
Thank you so much. Dr.
Thank you.
Pulver, will you tell us about your training and your background and how you got into the medical field?
Sure. I have a lot of physicians in my family, so was interested in medicine from the beginning, really. And I trained in emergency medicine after going to medical school at the University of Pennsylvania Med School in Philadelphia. And then emergency medicine has developed as a specialty over the last 20 and 30 years, and now just about every physician who works in the emergency department is residency trained and board specialized in emergency medicine, which means that after medical school you do your residency training, your specialty training in emergency medicine with the plan on working in the emergency department. So emergency medicine physicians typically don't have a private practice. They're hospital-based. They come into the emergency department. They know when their shift is going to start. We work very hard for 8 or 10 or 12 hours, depending on the length of our shift. And then at the end of our shift, we're finished, and we go home and don't have a private practice. So that's emergency medicine. Occasionally, patients will ask me where my office is, and I tell them that you're in my office. We emergency medicine docs work in the ER.
Excellent. So Ken, tell the viewers a little bit about your background and how you got into the medical field.
You got it. I'm a physical therapist. I've been a physical therapist for about 27 years, working at this hospital for 25, but I've also had experience in long-term care, working with pediatrics, working with outpatient, and really what got me started in it was two things. One was I really wanted to work in the sports, and then the other thing is I had a cousin who had cerebral palsy. And during that time, someone that really took their time with them and really made a difference in their life was a physical therapist, which opened up that whole opportunity for me to choose that as my field. As I got into it, I thought I was going to work in a sports team and work at sports only. Once I got into working at the hospital and working through that full continuum, being able to see outpatient, inpatient, and really kind of connect with our community has been a passion of mine to kind of really continue that rehab focus. And in the world of rehab, it gives you an opportunity to almost change your whole profession and work in a different venue. So working in home care was a lot of fun too, and it's been a great time in my life to give back to the community in that way.
Well, that's excellent. Do you actually still do home care, or it's all done on-site?
Everything that I do now is really on-site. The majority of the time that I work with patients, it's in the outpatient arena or in the hospital. Through parts of my life, I did home care, and that was a lot of fun, being in the people's homes to kind of help them functionally return to their life. But recently, most of my time is administrative, and then treating patients in the hospital or in outpatient setting.
Very interesting. Dr. Pulver, what would you say are some of the most extreme situations that you've seen in an emergency room?
Well, we see everything in the emergency department. We have a lot of patients who come in with every possible problem, trauma, medical illnesses, and the extreme situations are when patients are very, very sick. Patients who are having a heart attack, patients who are having a stroke, patients who have an illness and with what we call now a severe sepsis. So those are the extreme situations. Occasionally, Ocean Medical Center is not a trauma center. We have a sister hospital 10 miles away that is our regional trauma center, but we still see a lot of moderate trauma, motor vehicle accidents and falls down steps. Occasionally those patients are very, very sick as well. So those are the extreme things, are when patients come in trouble.
You know, we hear a lot these days about sepsis. Why does it seem to be on the rise in hospitals, or is it just something that I'm sensing?
What is happening is that we are getting a better understanding of how to diagnose sepsis early and treat it better than we used to treat it. So we're very aggressive in recognizing sepsis. Sepsis is a overwhelming infection, and the body's immune response to that infection. And sepsis can be has a high mortality, can be deadly, but the studies have shown that with aggressive early treatment, you can make a big difference in terms of survivability.
But I did get a sense that it's on the rise in hospitals in the United States. Have you heard that? Is that a true fact, or is just something that the public is crying out?
I think that as the population ages in general, there are more senior citizens and people who are not as healthy living longer, and so they get sicker more often.
And they're more vulnerable once they're in the hospital.
And they're more vulnerable because they're living longer with the medical conditions. Patients with kidney problems and diabetes and high blood pressure, and patients who have had heart attacks used to die, and now we keep them alive and with the quality of life, but they're more at risk of getting sick.
I understand. Ken, Dr. Pulver mentioned about falls being an issue in the emergency room, people coming in from excessive and extreme falls. Mm-hmm. What should you do if you fall? What are the most major injuries related to falls?
Falls is an epidemic that is really, going across the country. In our geographic area, there are a lot of seniors, but it happens to everybody. I mean, everybody in the audience, I'm sure, has fallen. But there's about 3 million falls a year. That leads to about 800,000 admissions to a hospital at a cost of $50 million. It's a huge issue, and a large percentage of those can be prevented if we do some key things on just taking care of ourselves and our home and our surroundings. But it's definitely, there's a lot of things out there that we can do to take care of ourselves, with exercise, including trying to get stronger for balance, flexibility. We can take care of our home and doing a fall safety assessment of our home. So we can really do a lot of things to prevent trips and falls.
Tell us about a fall safety checklist.
So online, you can pull down a fall safety checklist and helps you to just assess your home. And it gives you some key opportunities in the way of making sure there's enough lighting. With dim lighting and not enough light in the area, you can easily trip over something. There's making sure you have railings going into your house, railing on stairs, and also some sort of hand railing in bathrooms. A lot of falls happen in bathroom. It's wet, slippery, so having that in the shower as well as next to the commode or next to the bathroom or the toilet gives you something to hold on to in those times when you're standing only on one leg, which happens quite often in there. If you have any balance issues, anytime you take one support off, it obviously increases your risk. Throw rugs are a physical therapist's nemesis. We definitely don't want them to be around as much as possible. They have a lot better non-skid surface on them now, but some of them still don't have that. So if you get rid of or eliminate all of your throw rugs, that would help prevent an ability for you to fall or slip on that. Another thing is with extension cords. Extension cords are easy for us to trip on, as well as decluttering the house. We want to make sure that we have less is more, trying to have less things around for us to slip and fall on.
Thank you. That's very helpful to the viewers, especially for our elderly parents and relatives. You might want to make note of this in order to help your elderly parents and relatives and friends, because a lot of them have these loose rugs, as Ken was saying, and cords and all kinds of things in the house. They might have pets who have toys on the floor, and they're not aware of the fact that this causes a tripping hazard for them. So we should take heed to what he's just said. Thank you for that.
Thank you.
Dr. Pulver, the flu season, what suggestions do you have? First of all, is it too late once January hits to get a flu shot? Talk to us about this season.
No, January is not too late. It's better to get your flu shot earlier, but if you haven't had it and it's the middle of January, it's still plenty of time to get a flu shot, and it's very, very important. It's one of the most important things you can do to guard against the flu. It's not 100% protection, but it is protective, and even if you do get the flu, your flu shot will help to lessen the severity and duration of your symptoms.
So people sometimes mix up the difference between a flu and a cold, but the symptoms are so similar. How can we know the difference?
Well, if you get the flu, you'll know. There is a lot of overlap, but colds and upper respiratory infections generally come on gradually. You may have some nasal congestion, a little bit of a sore throat, and a low-grade fever. The flu, people feel like it hits you like a ton of bricks. You just are suddenly overwhelmingly exhausted, and you feel weak. You typically spiking high fevers and having a cough, and it's really can be a profound illness. So there's some overlapping symptoms, but colds are typically easy to tolerate and ride out, and the flu can get you into trouble in a hurry.
Well, speaking of trouble, there's a lot of misinformation out there, and people tend to think that they can get the flu from getting a flu shot. Can you speak to that, please?
Yes, you cannot get the flu from getting a flu shot. Some people will get a very mild symptomatology. You might feel like you have a low-grade fever for a day or achiness, and this is a small percentage of people. But no, you cannot get the flu from a flu shot.
I'm going to ask you to go a little deeper because I'm thick-headed Italian. So the question is, if you don't get the flu from it, then why do you get symptoms? Because I've heard that it's a dead virus that they're putting in. Can you explain it scientifically? Because if it's dead, then why are you getting symptoms? It's one or the other in my book.
Good question. It's an inactivated virus. So what happens is that you get the flu shot, which injects this foreign substance into your body, and your body recognizes that as a foreign entity and begins to mount an immune response and make antibodies. And that process may give you some subtle, vague symptoms, some small percentage of people. Most folks who get the flu shot are asymptomatic with it and might have a little soreness at the arm, but very, very mild. But then your body is mounting an immune response and making antibodies so that if you do get exposed to the flu, you have a overwhelming immune response that prevents you from contracting it and getting sick with it.
I wanted to go back and talk about physical therapy for a little bit. What should someone do when they fall, and what are the typical injuries that you see that people then come to PT, physical therapy, for help?
So one of the things that happens when you fall, and it happens to all of us, is when you fall down, you get embarrassed and you want to jump up. So the first thing to do is not do that. Kind of assess and make sure. It is. Everybody kind of feels that embarrassing. You just want to get up, get out of the limelight and move on. But again, we all fall, so don't make it more than what it is. Just make sure that everything's okay, because you do run a risk of anything from a scuff on your hand to a little bruise, all the way up to fractures, open wounds, and then you can also hit your head and get a concussion or a traumatic brain injury. And so it can really run the gamut from minimal all the way up to life-threatening.
Wow.
And we see many people who have fallen in the emergency department with all kinds of injuries from hopefully nothing's broken, but fractures, wrist fractures, broken bones, and fractures mean the same thing.
Yes,
So-
I've often wondered about that, and I think the viewers do too, because one person has a broken something and someone else only has a fracture.
I will sometimes tell a patient that they have a fracture of the wrist, and they will ask me, "But did I break the bone?" And it's the same. It's the same thing.
Just different terminology.
Yes, exactly. Two different ways to say the same thing. The bad injuries are hip fractures, which can, even for senior citizens, be life-threatening and require an operation, and very, very quickly, too, because you can get deconditioned very quickly. If you're lying in bed with a hip fracture, you need to get to the operating room, get that fixed, get physical therapy, and start walking again immediately before you get too deconditioned.
What do you mean by deconditioned exactly?
Well, if you're lying in bed, lying around, and not active and able to walk, your muscles very quickly atrophy, and you lose cardiovascular conditioning. So being sedentary, being unable to even get up and walk, is not good for your health.
I see. I mean, obviously, in the past 20 years, we've seen that there's a rush to get patients up and out, but often it's the insurance companies that are driving that. But I'm happy to hear that there's actually a medical reason for this.
There is. It's important to have efficient, quick care, and nobody wants patients lying around the hospital these days. So things move pretty quickly, yet we want to make sure that our patients are doing well, and we don't want to discharge them too soon.
Exactly.
Yeah, we at the hospital really have worked, through the emergency room, right through the whole process of really trying to put the right patient in the right place at the right time. And that, it does, we do things quicker. As a physical therapist, as soon as the patient has their surgical intervention, especially with a hip fracture or a total joint, we're getting them up that day. It is much quicker.
The same day as the surgery?
Yes,
They're
the same
up?
day. The same day, up moving usually. And the reason is because what Dr. Poehler was speaking of. The more you're laying around, we've talked a little bit about the flu. If you're in bed in the flu, if any of us are in there for 2-3 days, think about how weak you feel. That happens very quickly to us. So we want to get that intervention as quick as possible. No one wants to be in the hospital. So
Exactly.
we want to get you up, get you functional, get you moving, and get you out of there and get you home where you would like to be with your loved ones and your family.
Thank you. Do you notice a big difference with respect to the patient's cooperation or cooperative mannerisms when it comes to a different age range?
I think that there are definite variability.
Tell me about it. What do you run into?
Well, and I think the seniors, I think they definitely are they're very appreciative, thankful, supportive. I think certain age groups are, maybe a little bit more, looking at what we do a little bit more with a critical eye. And that's okay. I think that has helped us as healthcare to really try and bring something different to the table, and that's really taking care of people and not just their disease process and not their injury, but the whole body and the whole person. It's about the experience that they're going to feel for the whole time. Again, no one wants to be in the hospital. I think one of the things that we've done is we've really worked to look at the entire care. So it's not just about treating the hip fracture. It's about treating the whole person and their family and looking at that whole experience. And I think, we were talking about the difference between a fracture and a broken bone. In healthcare, we have our own vernacular, we have our own language, and we're trying to also bridge that so that we're educating people and teaching people all those components in language that they understand. So when they leave, they really feel that they're aware of the whole magnitude of what they're going through, and then they're ready to leave and be independent on their own.
Well, Dr. Pulver spoke about people breaking their hips and shoulder. What is the typical rehab process involved with this? How long can we expect to be in rehab? How often is it at a center? Does it continue at home? How does that all work?
It's going to be different for every person. So it's a VIP process, very individualized plan. So it's going to be different for each person. However, in the hospital, they're going to have the surgery hopefully within a day and only be in the hospital for another 1 to 3 days. So they're going to be out of the hospital in a couple of days and then be home with home care or to a facility, depending on what their needs are. And then from there, then they would go to an outpatient center for a period of time, working on building up their strength, their endurance, their balance. And I think the one thing that we're going to also try and ascertain at that point is why they fell. So it's not just about the fact that they fell and that they fractured their hip, but we're going to try and dig down of how many times they fell leading up to that. Because very often people fall 3, 4, 5 times and don't have an injury, which, thank goodness, but it would be nice to get an opportunity to work with them then before they fracture. But since that didn't happen, we dig into why they fell, and maybe there's some things that we can do to help prevent, with either working in their house, giving them assistive device, or building them up from a strength perspective to try and limit them falling again and then coming back to see Dr. Pulver and his great team.
So that's what you meant about working with families.
Correct.
As well.
Correct. I think it is about the whole unit. It's not just about the patient anymore. It's really about the whole family, the whole process, because everybody's going to help to try and prevent that re-injury and that readmission or potential re-fall and fracture something else.
Absolutely. Dr. Pulver, what should you expect when you go to an emergency room these days? What should you bring with you? How do we anticipate hopefully an event that will never happen to any of us?
Right. If you do have to come to the emergency department, it is important to remember to bring a list of medicines that you take, if you can do that, and if you have a little card with the most important parts of your medical history, those pieces of information are very, very helpful for the emergency medicine team that's going to be taking care of you. When you come in, there will be a triage process. If you've called 911 and the ambulance brings you in, you're going to come in with an ambulance and be met at the door by a charge nurse and get placed very quickly into a room. And if you walk in, you'll see a nurse up front as well and get a triage process with your vital signs and quickly brought back to the emergency department. We really want to get our patients into the ED. We don't want them waiting out in the waiting room, and generally we can do a very good job with that. When our patients don't make appointments, and sometimes it's crazy busy, and when it is that busy, sometimes some of our patients will have to wait in the waiting room, but we try very hard to minimize that whenever possible. So you'll come in, you'll see the triage nurse, you'll get to a treatment bay, and then an emergency medicine provider will see you and initiate care. And the care depends on what the problem is.
By the way, you use the terminology triage. Can you tell the viewers what that word means?
Triage is really means to sort out, and what we do is identify how sick somebody is and the nature of the problem, and then get them quickly to the appropriate part of the emergency department. There is a resuscitation area, there's an acute care area, and there's a what we call an express care or fast track area. So patients might get into any of those areas depending on the triage process.
Thank you. That explains it. We get into the emergency room, and there's no one ahead of us, and all of a sudden, there's 5 people that they're taking before us, and we don't understand. And this explains it, because with the triage process, they analyze the severity of the illness or injury, it sounds like, and ascertain whether or not they should be seen first.
Right. We really want to see everybody quickly, and most of the time, we are efficient enough to be able to do that in spite of the volume and the problems that we encounter. So,
for instance, somebody with a broken leg, would this be considered high on the list, or medium or low, in terms of expediency?
That's a great question. There are different ways to break your leg. And
Somebody fell. Somebody fell.
Yep. If you have a non-displaced subtle fracture around the ankle, it may not be as emergent, and you might even be able to get into the express area. That's very different from somebody who breaks their hip and has a deformity and can't walk. They are sicker and would be triaged appropriately.
Thank you. So interesting. Speaking of injuries, and we're going to close in just a moment before we bring in another interviewer, can you tell us what the best orthopedic care is and how to find an excellent orthopedic surgeon?
Ooh, that's a tough one. I think the part of that is really just in today's day, we have the ability through the internet to be able to look up information on pretty much anybody, any doctor, anything. We have the wonderful opportunity to work with incredible doctors. I think it's really just getting out to your community, talking to your friends, talking to people, and getting those recommendations. And then also, when you call to make the appointment, talking to the front desk, really just building that connection with those physicians. We're lucky at the hospital to work with physicians and orthopedic surgeons that have been trained in the best centers across the country. By having that opportunity, they really bring a breadth of knowledge and opportunity for us to challenge us to get better in quality and compassion and really taking care of the people. But I think it's your community, talking to your friends, and really building that comfort level with that physician. Most physicians and most healthcare, actually all physicians, all healthcare providers really got into this to take care of the community and to do the right thing. But you have to build that connection with those physicians and try and work with that.
Well, thank you, gentlemen, so much for coming on to the show and helping the community learn about what to expect when they go to a hospital, how to get the best physical therapy treatment. This has been very informative. We hope that you'll join us again.
We'd love to.
Thank you, yes.
Thanks for having us on.
Wonderful. Viewers, we're on every Tuesday night at 8 p.m. in Staten Island. We're on Wednesdays at 4 p.m. in Manhattan. And we also air in all the boroughs on Tuesday night at 8:30 p.m. You can visit the Heart of New York show on YouTube, and we'll provide a schedule for you to view. So I'd like to bring on one of our co-hosts and co-producer, Peter Hart, who's got a few questions to ask of you. And give us just a moment, and we'll be looking forward to bringing him on.
Hi, I'm Peter Hart, and I'm telling you, I am very excited about this show, and I'll tell you why. Because several years ago, I was crossing 53rd Street going down 8th Avenue, and I got hit by a taxi cab. Turned the corner, and he accelerated and hit me. Okay, before I knew it, it was like right out of the movies. I smashed on the windshield, I ended up on the street, and I almost died. Here comes the ambulance, and they take me to a trauma center. That is no longer in business in Manhattan. Okay, this is very important, because what these gentlemen right here are in a financially stable, upcoming major institution that treats people from their heart, and not only from their professionalism, but from their heart, and that makes all the difference in the world. So I get down to the hospital, I'm in the emergency room, and they're not doing anything to take care of me. Nothing. I have to wait 20 minutes or so just to get some type of relief from the pain that was so excruciating that it almost made me pass out. So, bottom line is, the hospital's out of business. The workers there were the most unprofessional people in the world. Now, when something happens, okay, to the extreme, okay, where you'll have a heart attack or get hit by a car, and you go and the ambulance takes you to a place like Hackensack Meridian Health Ocean Medical Center, you have a doctor here and a person in charge of physical therapy here that has a whole crew that will not only take care of you, but show you the perfection, and it comes from their heart. Okay, and this is what makes this institution a good one and an upcoming one. I'm so excited to tell you what I have seen here is such professionalism, and most important, because anybody can go to any major doctor, especially in anywhere in New Jersey or New York. But here it comes from the heart, and a lot of you out there know what I'm talking about. Ken, you'd like something to add to close us?
Yeah, I think if you came to Hackensack Meridian Health Ocean Medical Center, Dr. Pulver would have taken really good care of you.
Why couldn't the taxi happen there?
Yeah. But I think, at Hackensack Meridian Ocean
Right.
Medical Center, we've really had a lot of growth over the past few years. We just got a Leapfrog A rating, which is a quality rating from the nation that kind of has said, our quality is incredible. We just became a teaching hospital, and we have residents walking around challenging us to continue to be better.
Fantastic.
We have multiple disease-specific certifications through the Joint Commission. We really have grown by leaps and bounds for having the most advanced technology. We were able to build a whole new unit, a whole new floor that is private rooms and an ability to kind of change the whole way we take care of patients. But you said something that is true. And it's about people, and it's about that caring, and about that compassion, and about taking care of those patients. And that's really what it's all about, is really coming out of, taking the clinical quality, taking all that component and doing the right thing clinically, but also caring for the person and caring for the patient and the family. And that's, I think, something that at the family that I have at Ocean Medical Center really is just, it's a different paradigm. So it's been a pleasure to work there for 25 years.
It makes all the difference in the world. We have an institution here, Ocean Medical Center, that's financially stable and getting stronger, but the people behind it is what make it, are the pillars. Okay, and when you have the professionalism and the character and the caring like these gentlemen do, it's the place to be if you need to be. I'm not wishing anybody to go to the hospital now, don't get me wrong. Okay, but when you're there, you want to feel that you're safe, secure, and you're going to get better by the grace of God. Thank you all for watching.